get you more on the situation in Hammanskraal. Bring in our reporter Zikhona Tshona, who spent the afternoon there. Zikhona is with me in studio tonight. Zikhona, so we're just playing some of the comments made by the national government delegation at the briefing today. What more do they have to say?
Urgent is the addressing of the water issues in Hammanskraal. For years now, residents of Hammanskraal have even taken to the streets to say our water is just not in good quality. In fact, in 2019, the Human Rights Commission released a statement to say that the water in Hammanskraal is not good for consumption. Outside the hospital, there were residents of Gauteng as well as Hammanskraal who had been protesting there since the morning. They heard that the mayor was in fact going to be visiting the hospital on an oversight visit. The mayor's visit was blocked by residents. He had to go and did not end up actually being part of the delegation of the people addressing the press briefing there. That's the Tshwane Mayor, Silas Brink, who was there in the morning, but then he had to be whisked away because it was simply not safe. And residents were blocking the entrance to the hospital. But inside, we were then addressed by the Deputy Minister of Health, Dr. Newzroom, as well as the Deputy Minister of Water and Sanitation, David Mahlobo. They've said, as you've mentioned, the command center will be erected at that particular facility. We know now a total of 41 people are active cases of this cholera outbreak here across the country. Majority of them coming from Gauteng, 35 of them, in fact, coming from Gauteng. And, of course, the death toll is now, unfortunately, up to 15. But the minister says people just need to play their part in ensuring that they keep themselves safe, wash your hands regularly, and just basically try and maintain basic hygiene. Let's take a listen to what the Deputy Minister of Health had to say at the briefing.
We just need to be attentive that we now know that there's an outbreak of cholera. And we also know clinically that this is a very, people who actually conduct it, they dehydrate very fast. They lose water very fast. So citizens, please do not waste time. Once you actually have any diarrhea, we will tell you whether it is cholera or not cholera. But just rush to our facilities, because immediate intervention, even in the clinic, by the time you get to the hospital, in the clinic, when they get they see you there and they have a drip, they can start already intervening.
And Zikhona, you were able to make it into the hospital where the dozens more people who are in fact still sick with cholera are being treated. What did you find when you got there?
So there is a ward at the hospital that has been designated to deal specifically with the outbreak. We were able to go there and speak to patients who are receiving treatment at that healthcare facility. Many of them speaking about particularly the symptoms that they felt, that they just went to open a tap and they drank water, and a couple of hours later they either got diarrhea or felt severe cramps. And the Deputy Minister of Health is saying, particularly with dehydration, it needs to be dealt with immediately. So if you feel any symptoms of the cholera in your body and you go to a healthcare facility now, any of those symptoms, including diarrhea, dehydration, vomiting, severe cramps, you're going to be treated as a cholera patient because they want to nip it in the bud. They don't want it to spread any further. So if you are dehydrated and you go to a healthcare facility, they're going to hydrate you as though they are hydrating a cholera patient.
And we'll speak in a moment when we speak to the NICD about the symptoms of cholera, because people may mistake them for other things as well. For example, if you've got diarrhea, you may think you may have eaten something that was off and that's why you're feeling sick. But we'll talk to the NICD about that. I want to go back to the issue of these patients who are already in hospital. What is the severity of the illness? I asked that because around this time last night when we spoke to the health MMC, the death toll was at 10. Now, 24 hours later, 5 more people have sadly died.
So we were able to go to where the patients are a little bit better. They were able to communicate with us. They were able to tell us about their history with water in Hammanskraal. We spoke to a man who said he's been staying in Hammanskraal for 8 years, and for as long as he's lived there have been water issues. And he was saying now, going into hospital and knowing that people in his community have passed away, he's got 2 children. He's eager to get home. And he's saying government needs to address this urgently because people are losing children, people are losing their their parents. And he's saying he's a breadwinner at home and his 2 children are waiting for him to get out of hospital. And he's saying he's happy that he was able to recover. But what lies ahead for the people there that continue to live with this? I mean, today there was a call for people from Hammanskraal to not drink the tap water. So there will be tankers that will be distributed out to those areas to ensure that people do have access to quality water. People are also urged to boil water before consuming it, whether it's for cooking or whatever the case may be. Boil it before you drink it.
And are people, Zikhona, I'm wondering, based on the conversations you've had today, do they think that anything will change, given that we've seen intervention from the Human Rights Commission, various political parties have made their way in and out of Hammanskraal, talking about the very issue of a lack of clean, safe drinking water, yet clearly the problem persists?
And it's been years that they've taken to the streets for the water issues in that area. And they've had many people going there to make promises about resolving it. Now they find themselves falling under a municipality that is at war with itself, and leaders there fighting for positions, who's next, who's going to have power, what coalition, who's going to have this position. Because even there, outside the hospital, there were people dressed in different political party T-shirts. So you wonder what's at play here, at the risk of people's lives. You know what I mean? 15 people's lives later.
And there's already been, worth pointing out, a political blame game between the ANC and the DA, who've both had a turn to run Tshwane and would have presided over a water crisis at some level in Hammanskraal.
I was able to speak to a community forum member there who said they're tired of the political grandstanding. They just want service delivery and they want water now. Because 15 lives is 15 lives too many. And we need to get to a point where our political leaders take that seriously. Because at the point at which one person had died, that was already too much. And we need to get to where we now focus on water being delivered to the people of Hammanskraal. I think the Deputy Minister of Water and Sanitation did say at the press briefing today that they would like to reach a point where they go to court and have a court order that says we can't touch any decision that is made here with regards to this community getting water, because it's certainly not acceptable that this was able to go on for so long.
Zikhona Tshona, thank you very much for that reporting on the water crisis in Hammanskraal and the outbreak of cholera. Well,